Depressive disorder, also known as depression, is a common mental disorder. Depression is different from regular mood changes and feelings about everyday life. It can affect all aspects of life, including relationship with family, friends, and community. The most common types of depression are four types. One major depression is a state where our dark mood is all-consuming and one loses interest in activity, even ones that are usually pleasurable. Two, persistent depressive disorder, formerly called dysthymia. Many people with this type of depression type are able to function day to day, but feel low or joyless most of the time. 3. Bipolar disorder. People with bipolar disorder have symptoms look like the opposite of depression. 4. Seasonal affective disorder. This type of depression emerges as days get shorter in a fall and winter. Depression types unique to women. 1. Perinatal depression. This type of depression includes major and minor depressive occur during pregnancy or in the first 12 months after delivery. 2. Premature dysphoric disorder. This type of depression is a severe form of premature syndrome. The next topic ประภาพร วรวัฒน์
What are antidepressants? Antidepressants are medication used to treat depression and other mental illness. How antidepressants work? There are three basic molecules known chemically as monoamines that are believed to be involved in mood regulation. These primarily work as neurotransmitters, which transmit nerve signals to their corresponding receptor in the brain. Antidepressants work by influencing this neurotransmitter, which include dopamine, norepinephrine, serotonin. In people with depression, the availability of this neurotransmitter in the brain is characteristically low. Antidepressants increase the availability of one or several of these neurotransmitters in different distinctive ways. Antidepressants have 5 major types, but this video presented to you for one type of antidepressants. That's selective serotonin reuptake inhibitors. There are a number of antidepressants that work by preventing the reabsorption of neurotransmitter into the body. Collectively known as reuptake inhibitors, that prevent the reuptake of one or more neurotransmitters so that more are available and active in the brain. For examples, fluoxetine. Why we choose fluoxetine? Fluoxetine is often used to treat depression and sometimes obsessive-compulsive disorder and bulimia. That helps many people recover from depression and it has fewer side effects than some other antidepressants. Thank you. Next topic.
Who can take fluoxetine? If you are 18 or over, fluoxetine can be prescribed for you as a licensed medicine for depression, bulimia, and OCD. There is less research about this drug. Its use and effectiveness in young people, but it can be prescribed for depression to help people aged 8 to 17 years old who may not be able to take fluoxetine. Fluoxetine is not suitable for everyone. Check with your doctor before taking it if you 1. Have ever had an allergic reaction to fluoxetine or any other medicine. 2. Have a heart problem as fluoxetine can make your heart beat fast or cause an irregular heartbeat. 3. Are trying to become pregnant, are already pregnant, or you are breastfeeding. 4. Have glaucoma. Fluoxetine can increase the blood pressure in your eye. 5. Have epilepsy or are having electroconvulsive treatment. Fluoxetine may increase the risk of having a seizure. How to take it? You will usually take fluoxetine once a day with or without food. You can take fluoxetine at any time, but it's best to stick to the same time every day. If you have trouble sleeping, try taking it in the morning. How long to take it for? Once you are feeling better, it's likely that you will continue to take fluoxetine for several more months. Most doctors recommend that you take antidepressant for 6 months to a year after you no longer feel depressed. Stopping before that time can make depression come back.
If you forget to take fluoxetine, what should you do? If you occasionally forget to take a dose, just take your next dose the next day at the usual time. Never take 2 doses at the same time to make up for a forgotten one. If you forget doses often, it may help to set an alarm to remind you. And how about what side effects may you notice from receiving this medication? 1. You would have allergic reactions like skin rash, itching, swelling of the face, lips, tongue, or throat. 2. Bleeding, like a red or dark brown urine, vomiting blood or blood material that looks like coffee grounds, small red or purple spot on skin. 3. Heart rhythm changes, have fast or irregular heartbeat, dizziness, chest pain, trouble breathing. 4. Loss of appetite with weight loss or have low sodium level. You would have a muscle weakness, fatigue, headache, or confusion. Another is serotonin syndrome, irregular heartbeat, muscle stiffness, sweating, high fever, seizure, vomiting, or diarrhea. Sudden eye pain or change in vision such as seeing halos around lights or vision loss. If you have one of these symptoms, please call the doctor for the medical advice about side effects.
Fluoxetine and pregnancy. You can take fluoxetine during pregnancy. Some studies have suggested that fluoxetine might occasionally affect the development of a baby heart. However, if there is any leak, it is small and most babies born to women taking fluoxetine have a normal heart. When fluoxetine is taken in the week before the delivery, it can sometimes cause short-term withdrawal symptoms and very rarely breathing problems in the baby. Your baby will be checked after birth and given extra care if needed. Taking fluoxetine in the last month of pregnancy may slightly increase your risk of bleeding after delivery. However, because this side effect is rare, it's not a reason to stop taking fluoxetine. If your doctor or health visitor say your baby is healthy, you can take fluoxetine while breastfeeding. Fluoxetine passes into breast milk, usually in very small amount. It has been linked with side effects in a few breastfed babies, but has been used by many breastfeeding mothers without any problem. Fluoxetine and fertility. There is no evidence to suggest that taking fluoxetine reduces fertility in either men or women, but speak to a pharmacist or your doctor. If you are trying to get pregnant, they may want to review your tissue.
Drug interactions may change how your drugs work or increase your risk of serious side effects. This information does not cover all possible drug interactions, so you must always inform your doctor and pharmacist that you are currently taking any medicines, dietary supplements, or herbs. Do not start, stop, or change the doses of any medicines without consulting your doctor. Fluoxetine can remain in the body for several weeks after your last dose, and
may interact with many other drugs. So, before using other drugs, tell your doctor or pharmacist if you have taken fluoxetine in the past 5 weeks. Drugs that may interact with fluoxetine include medicines that are removed from the body through certain liver enzymes, including vinblastine, medication to treat arrhythmias such as propafenone, tricyclic antidepressants such as disipramine, other medicines that can cause bleeding and bruising include antiplatelet medicines such as clopidogrel, non-steroidal anti-inflammatory drugs, NSAID, such as ibuprofen, anticoagulants such as warfarin. Hopefully, what we have given you knowledge, it will help everyone understand more about fluoxetine. Thank you.